screen, Sophie?
Yeah,
Yes, thank you.
So yeah, morning everyone. I'm Sophie. I'm a graduate trainee in housing management, and I'm supporting the Refugee Resettlement Programme with Refugee Week and a series of online workshops. So today we're here to talk about the COVID-19 vaccine. And I'm joined by Sharon Egdell, who is our infection prevention control advisor. And also by Hala Abusin, who is a pharmacist in Hammersmith and Fulham. So I don't know, would you like to both introduce yourselves?
Yeah, I'll go first. Yes, so my name's Sharon Egdell. I'm the interim infection control specialist advisor for the council. My background is in infection control, communicable diseases. I've worked with Public Health England. I've worked across the NHS in a variety of settings.
And Hala?
Hi, good morning everyone. Thank you for joining us. I'm Hala. I'm a community pharmacist, and I've been working within the sector for a number of years now. So my role involves everyday medicine supply advice, help with healthcare and health provision within the pharmacy that I support. But I also work with one of the local charities in Hammersmith and Fulham, helping the clients and some of the refugees, the newly arrived, to navigate the healthcare system and have access to GPs, medicines, and any other advice that's needed within the NHS. And I'm an Arabic speaker as well, so I tend to also be able to support with translations. So that's my job, and I'm happy to be here, more importantly.
Great, thank you. And Camilla?
Hi, thanks Sophie. So my name is Camilla and I work as part of the NHS engagement team in Hammersmith and Fulham, Westminster and also Kensington and Chelsea. So we're the commissioner side of things rather than sort of provider side. So I'm curious to hear how we can sort of help improve uptake of the vaccine amongst our residents in Hammersmith and Fulham. So thank you for having me.
Great, no, welcome. So I'm just going to share my screen and then Sharon is going to talk us through it. And as I said, we're live streaming this on YouTube, so it will be available, it will be recorded and it will be available for anyone, for the general public kind of later in the week if they're still interested. So I'll just share that now. Great. Sharon, do you want to, I'll share my screen, but if you just let me know when you want me to move on.
Yeah, of course. Thank you very much, Sophie. Excellent. Okay, thank you everyone for joining, or if you're watching this as a stream on YouTube. We're just going to talk about a little bit about the COVID-19 vaccine. Myself and Hala are here to answer any questions that you have. So next slide, please. So it's just important to say that this presentation is not in any way intended to provide you with any medical advice, and as such, if you've got specific concerns around your health, you should discuss that with your own GP or access some specialist medical advice. The content of this is based on the current published information. We do know that this is a very movable feast. It's changing daily at the moment in terms of vaccinations. So always go to the websites which are on a slide later on in this presentation just to check the relevant updated advice. So what we thought would be helpful today would be to talk about the common myths around the COVID-19 vaccines, how they work, but I'm not going to go into the pharmaceutical side of it because that's not my area of expertise, but just a general understanding. The current NHS guidance in terms of age groups as it stands at the moment, and then there's an opportunity for you to ask any questions that you have, and we'll try and answer them for you. Okay, so currently Hammersmith and Fulham are putting huge effort into vaccinating their population. The reason being is obviously we want to try and stop the community transmission of this virus. We do know that the Delta variant, which is the variant that was first identified in India, is attacking people that are not vaccinated currently, that are not fully vaccinated. So we are having a really big concerted effort to try and reach those members of the population that have not yet had their vaccine, that are eligible to have their vaccine. And we understand that there are some challenges for people sometimes to access the mass vaccination centres or their GP surgeries. So we are now starting to look at pop-up vaccination centres, which we're going to advertise widely. We've also got our vaccination bus, which we're very excited about. And we are also planning a big event next Sunday, which will be advertised as and when it's confirmed. But that will be to support lots and lots of people to be able to go to one venue and be able to achieve that. And the reason is that we still do have one of the lowest vaccine uptake rates in the northwest of London. But as I say, we are trying very, very hard, and it's really, really important if you are in those eligible age groups now that you try and get your vaccine. In the past 7 days, we have had 141 new cases in Hammersmith and Fulham. And as you will have seen in the news, about 96% of those cases now can be attributed to the Delta variant. So that's the variant that was first identified in India. So we do know that that is a risk to our unvaccinated population, and also to people that have only had one vaccine, because we know the vaccine efficacy is around about 33% if you've had one, but that jumps up to over 80% as quoted last week by the scientists if you've had 2 vaccines. And we'll talk about the importance of allowing for that immune response to happen as well. The 7-day rate of COVID cases in Hammersmith and Fulham is 57.3 per 100,000, and that is jumping up daily, as you can see, and that was on the 11th of June. So we are really, really concerned now that we do try and break those chains of transmission in the community, and that's why we're having these concerted efforts. So look out for on our social media and our Twitter feeds, and also on the website, to see where the vaccination bus is going to be and where the pop-up centres are going to be, because we're very keen to come to you now with the vaccine rather than you having to come to us. So the common myths around COVID-19 vaccines are that people want to wait until there's been more research done. They feel like it's been too rushed. And Hala will probably be able to come in and help me out with this as well from a pharmaceutical point of view. But certainly my understanding is that the technology that is used for these vaccines is different to a traditional vaccine. So this is what we call gene therapy. So this is where they use a messenger part of the virus to produce those antibody responses. So it's nothing new. We've had this kind of technology around for a very, very long time. But what was really good about that was that the research had already been done. And then the scientists were very able, very quickly, to adapt that to produce these vaccines. So it's certainly not been done quickly or too rushed. It's something that they've just been able, the scientists have been working on for many, many years, and have been able to take that science and adapt it to where we are. So if you want to add anything to that, Hala, or is that a sort of your understanding as well of these vaccines?
Yeah, I totally agree. So the technology has been used. For instance, we can use an example, the Ebola vaccine. So the science has been there for a long time, and I think the science started to be developed when we first had the first SARS outbreak. So really, it's been around for that long. It's definitely not rushed. And one of the other things, I wasn't sure whether you're going to come to that, Sharon, but it's the mRNA technology as well, is actually used as a vehicle to transport the gene code into the body, and then actually it gets excreted. It leaves the body after 2 to 3 days. So I wasn't sure, because that's quite important. I think sometimes a lot of people don't know that, and I think that for me is an important part to highlight as well. So
really important. Thank you, Hala. Yeah, I've got a couple of slides towards the end that talk about the mRNA, but that's really helpful, I think, to to clarify around the excretion of that. That's really helpful. Thank you. Please feel free to chip in on this bit, because obviously pharmaceutical is your bit. So people talk about the vaccine being able to change their DNA. As Hala has just alluded to, and as the slides later on show, it is a messenger RNA. So it's not something that is getting into your DNA, which is what makes up our body. It's a completely separate part of genetic coding, which just brings in that message for our body to recognize those spike proteins. And the spikes are the bit on the outside of the virus which attach to our cells. So it allows our body to recognize that bit of spike. So if we encounter the virus in the future, our bodies are primed, our immune systems are primed, ready to go. The vaccine contains fetal cells. It doesn't. There are no fetal cells or animal products in these vaccines. And then the other really important one now is I've already had COVID, so I'm immune and I don't need the vaccine. We do know that if you've had COVID in the past, you will have probably had one of the other strains of COVID, so your body will have been primed to recognise that strain. And we also know that your natural immunity, which is what you develop when you've had an infection, will start to wane after a few months. The important thing now is that we've got different strains circulating, so our bodies are not primed for those, because you may not have been exposed to that in the past. That, plus the fact that your natural immunity is likely to have disappeared almost by now from the first wave and the second wave, you won't have that immunity. So you absolutely do need to have the vaccine to protect yourself as much as you possibly can.
Can I just also add, please, Sharon, one of the things I often mention is that when we have the vaccine, so when your body reacts to an infection and mounts an immune response, that is dependent on your own immune system and the antibodies that are produced, whereas through the vaccine, it mounts a measured and actually more protective response to protecting you. So because it's measured through the vaccines, it's more effective and it's likely to have a better outcome. That's something else that I often like.
Yeah, that's brilliant. Thank you. That's really important points as well. Thank you. We're making a good double act here. It's great. Thank you. It's really good. So the other thing that people think can happen is that COVID vaccines can give you COVID-19. And the reason that people think that is that they may have had a relative that's had the vaccine and then is tested positive for COVID. So they assume that it's the vaccine that's caused it. What's actually happened in those situations is that you may have been exposed to the virus prior to having your vaccine 2 or 3 days before, or you may be exposed to it in that 2 to 3 week period after your vaccine, where your body is mounting that measured immune response that Hala has just talked about, because that's how long it takes. So if you're exposed to the virus either before or just after your vaccine, it is likely that you will get COVID-19, but it's not the vaccine that has given you that disease. You have been exposed to it and your body has not yet been able to mount that immune response. So that's another myth that we can dispel. We've already talked about the fact that the vaccine does not interact with our DNA in any way. And when we go on to the other slide about mRNA, myself and Hala will go into that in a bit more detail. It's really important to remember that your immune response, so the way that your body makes antibodies in response to the vaccine, takes a few weeks, and it can be up to 3 weeks, so 21 days at least, before your body mounts that immune response. So it's really, really important that after your first dose and your second dose, that you still exercise real caution, that you don't take risks unnecessarily when you're out and about. You're still very careful with your social distance. You're still very careful with mixing with people, sticking to the guidelines around households, etc. And just making sure that if you are aware that someone has symptoms in your household, that they get tested and that they isolate from the rest of the household so that you don't get that household spread. What we do know from the COVID-19 vaccine data is that it does reduce, well, they do, all of them reduce your chance of becoming seriously unwell from COVID-19 but you can still catch the disease. And that has always been very clear right from the start, that these vaccines don't stop you getting it, but they stop you becoming seriously unwell, or certainly reduce the chances of that and from death. And we've seen that in the care home sector, where all of our elderly vulnerable residents were vaccinated vaccine 1 and 2 early part of this year. And any of those residents that have gone on to develop COVID after that have either had no symptoms at all and were just picked up in routine testing that we do, or they were very, very mild symptoms, and they even questioned whether their results were actually correct because they felt pretty well. They didn't really think it was too much of a problem. So we definitely know that that is working, and the data that's coming out now that we're looking at is showing that in the majority of cases, the vaccine does stop you from becoming seriously unwell. So the side effects of the vaccine, the general sort of listed side effects are that when you've had your vaccine, you will get a sore arm because it is going into the muscle. So it's a deep injection, and it does feel like you've been punched in the arm for a few days after you've had it. You might feel a little bit tired, headachy, achy, a bit feverish. Certainly I did. I felt a bit grim for about 3 days, but nothing major. You just know that your body is doing what it's meant to do. And these are all signs that your body is mounting that immune response. It's just your body's reaction to that. But equally, you might not have any symptoms, and that's fine too. Everyone's different, but it's just good to be aware. And I'm not going to go into all of the guidance in the leaflet that they offer you in the vaccination centre, because the nurses do go through it with you before you're vaccinated, and also then hand you the leaflet when you leave as well. And it's really important that you just follow the current guidance from the vaccination centres. Allergic reactions, obviously any medication you can have an allergic reaction to at any time. You might have had it in the past and been fine, and then start to have serious allergic reactions. It's important to say that all of the staff in the vaccination centres that are administering vaccines are trained to recognise serious allergic reactions, and are also trained in how to manage an anaphylactic reaction until emergency help gets to the vaccination centre. So you are in safe hands, and I've certainly seen the training that my colleagues, nurse colleagues, had to go through to become a vaccinator, and there was an awful lot of information that they had to learn about the vaccines, the type of vaccines, how they work, all of the components of the vaccines. So there's a lot of training that's gone into these vaccination centres. But you must tell the staff before you have your vaccine if you have ever had a serious allergic reaction to drugs in the past, or if you've had a serious allergic reaction to a previous dose of the same vaccine, or any of the ingredients that are in this vaccine. You have to say, just because you've turned up to the vaccination centre to have your vaccine, it's not a given that you have to have the vaccine. So if there's health risks or health concerns that you have at that point around allergies, you must disclose them. Don't just go ahead and have the vaccine. And again, the vaccination guidance that they give you in the leaflet when you leave also talks about what to do if you have any serious reactions to the vaccine. And these are, in comparison to the numbers of people that are being vaccinated, these are still incredibly rare events, but they do happen, so we just need to make that clear. And these are the websites. So we've got the NHS website, which has lots of information on there, and that will point you in the direction of how to book a vaccine. But it also talks about the eligibility criteria, so the age groups that are currently eligible, the risk groups that are eligible. So it's really helpful to go on there, and it's continually updated, which is why we, sorry, I lost my screen there, why we point you in the direction of that. And if you are someone who likes to understand a bit more about the vaccine, the scientific background to it, the components of the vaccine, all the questions around pregnancy, fertility, all of those kinds of things, the Green Book is actually an immunisation book that healthcare professionals use, practice nurses use it, pharmacists use it, anyone that's using vaccines can go to the Green Book. It's something that's available. You can go and have a look at it if you are of that. If you're interested and you've got a scientific mind and you want to have a look at that, then the Green Book chapter 14A talks all about COVID-19, and that is continually updated as well, hence why we've put the web link in rather than copying from the document. Okay, so this is your opportunity to ask questions if you want to, if there's any questions at the moment. If not, we can go on and we can talk about the other slides, which Hala and I will be able to talk about these kind of questions around fertility, or I can go through them now, whichever way you'd like to do it, Sophie.
Yeah, so if we have any questions now, we can answer them, but we can also come back to questions at the end once we've gone through kind of the rest of the presentation. And
Yeah.
please feel free to put questions in the chat as well, and we'll make sure that those are answered for you.
Yeah, I probably can pick up a couple of these things now, because obviously we've talked about the wait until more research has been done. So we've talked about that. The vaccine content we'll talk about in later slides. Whether it affects fertility is a question that comes up an awful lot. So as I've said, I'm not able to give advice, medical advice, and this is in no way meant to give that advice. There is information out there around the vaccine and fertility. Currently, there is no evidence to suggest that it affects people's fertility, but if you are concerned about fertility and you are planning a family in the near future, it is always best to go to your medical practitioner, so your GP, or if you are already pregnant, then obviously talking to your midwife, because they are the people that are best placed to answer all of your questions around pregnancy and fertility. But currently there is nothing in the evidence, in the data, that's suggesting it will affect that. Eligibility and why they are prioritised. There were the Joint Committee for Vaccination and Immunisation, the JCVI, looked at all of the data, the evidence, and all of the risk groups when they were prioritising people. And we have got through an awful lot of those priority groups now. Currently, anyone who is 25 years and over is eligible for the vaccine, and you can book that through the NHS booking site. In areas where there are particular concerns around the Delta variant, the Directors of Public Health are looking at targeted vaccination programs as well for the over 18s. That is not something that is widely available, but it is at the discretion of the Directors of Public Health. If they think there is a real significant risk to public health, then they can look at that, but that's not something that's widely available. So it's 25 and over currently. The conspiracy theories and misinformation. So again, there's lots and lots of information out there on social media platforms, all over the internet, and none of it is kind of censored, if you like. It's out there. People can put whatever they like out there. There is an awful lot of anti-vaccination information out there as well. All I would say is that when you want to make an informed consent about something as important as this, it's really important to go to those credible sources. So that is your NHS website. You can look at the Green Book, and always go to those trusted websites rather than reading what your friends have put on Facebook or on social media platforms, because it's really dangerous, it's misinformed, and it can create real problems in communities as these rumours kind of spread.
Great, thanks for that, Sharon.
Can I also just add one thing before we go on to the next point? Actually, sometimes and what this is, sometimes I say this to patients who come into the pharmacy as well, because depending on where we get the information and the articles that we click on, sadly, the way that social media works is by using algorithms or using the history of the kind of articles that we read. And sadly, and this is definitely not something I've made up, this is a proven fact, is if you start to go down the route of looking at those articles, it's really more likely that those are the articles that will be coming up in your feed or in your information. And that's the kind of information that will be presented and fed, because this is just how social media algorithms work. So sometimes we also have to be mindful of, when we want to read the information, as Sharon just rightly informed us, is to actually go in and check a particular website and actually put that into the search bar, rather than click through to some of the links that we get passed through by our friends. And one of the websites I recommend is the BritishIMA.org, which is the British Islamic Medical Association, BIMA.org. They have a very sort of tested and proven facts, and it's by doctors who actually put their names to the information that they share with others, rather than somebody just mentioning the word doctor so my point is, when you are clicking through to information, is different from when you actually go in and put a particular website into your search bar and finding something that would be of some use. So I hope this helps as well. Just wanted to add that.
Yeah, that's really helpful. Thank you, Hala. And yeah, we'll make sure that that link is shared so that people can easily access it. I just wondered, before we move on, so I know that we're very aware that within certain communities there is kind of this historic kind of mistrust of some of our health services, which has had an impact on kind of vaccine uptake. I just wondered whether Hala or Sharon, if you could maybe talk a bit about that and kind of give some reassurance to people.
Yeah, I don't know if Hala, if you want to talk, because you're probably better placed because you're more in that community setting and you work with groups of communities as well. That's probably more helpful.
Yeah, I'm happy to come in at this point. I think one of the things that I've spoken about before is that when we are speaking about the lack of trust and looking at the messaging that we want to give people who are seeking our help and advice, is to kind of make it a little bit more targeted. So some people may have lack of trust for historical reason, as we've mentioned here. Some people will have lack of trust because of the content that's in the vaccine. So they're not looking at the historic lack of trust. Maybe it's more the content that's in the vaccines because of what they've read about having alcohol or pork or fetal cells, as we've mentioned earlier. Some people will talk about their hesitancy to do with how quickly the vaccine was produced. And then there are people who are talking about the historic lack of trust. But even the messaging has to be targeted to different groups. So for instance, in my case, I will use my mum and my husband's aunts as an example. So my mum was more concerned about the content that's in the vaccine from the religious side of things. And my friend's mum was more concerned about how quickly the vaccine came by. And then my husband's aunt was actually concerned about the lack of trust and some of the issues that were reported in the past. So even within the ethnically diverse communities, that message has to kind of be made a little bit more grainy as to who is concerned about what, rather than one umbrella message. So the historic lack of trust does exist. And we have a lot of people who bring this up as something that they're concerned about. But once we look at the new technology and the new science and how this is delivered and why taking the vaccine is to protect yourself and protect others around you, and we really look at the success data, we look at some of the side effects, for instance, that would affect certain ethnically diverse groups and how likely maybe we are to end up in hospital with long-term conditions, or some of the actual effects, maybe the clotting effects, or the lung effects, or the renal effects on the kidneys and effects on the liver. if they're more likely to affect us as a community or as an ethnically diverse community, I think it's incumbent on us to actually protect ourselves. And the history will remain. There are some other historical evidence that will remain and people will be concerned about. But if we move on from that, we are aware of it and we acknowledge it, and we move on to what is happening now and how we are protecting ourselves and our loved one, people around us. There's a lot of evidence now that there may be a chance that the vaccines would also impact transmission. So because when you're vaccinated, they found that there is less of the virus in the nasal cavities, which means we have less of a chance to transmit it to loved ones, for instance. And there is evidence for that, which means that the viral load, what we're holding as vaccinated people, is less. So then there is less chance of transmitting it to our loved ones. So there is no denial of the lack of trust that has happened in the past, but we are now in 2021 and we're looking at our own families and our own friends and our work colleagues as well. And the decisions have to be definitely made based on our individual circumstances, but knowing that we are protecting ourselves and others and having less of a chance of actually ending up in hospital or ending up with long-term side effects or, catching the, suffering from the virus and ending up in maybe, on ventilators and so on. It's just not a desired effect. So I think it's very important that we look at this pragmatically, acknowledge where we were, but we are here today and we need to move forward and support others as well. So if we get the right information, we will be able to make our own informed decisions, but support others around us as well to make their informed decisions. So I hope this helps.
Great. No, thank you, Hala. That's really, really helpful. And yeah, lots to think about. If, as I said before, if anyone does have any questions, please feel free to pop them in the chat and we'll get to them. But yeah, Sharon, if we're okay to continue.
Absolutely, and thank you for that, Hala. That's really, really important information and really good insight, I think. I think that you probably can talk these slides better than me as well. You're with your pharmacy and pharmacist head on. I think if you want to, because you're doing a grand job, I'll hand these ones over to you.
Oh, thank you. Thank you for that. It's very kind of you. Well, we touched on this earlier on about the mRNA technology being around. So the Pfizer vaccine and the Moderna vaccine have been formulated. It's just how things have been done while the research and the vaccines were being made. It just so happens the Pfizer and Moderna have used the same technology. So it's the mRNA messenger, as we spoke about before. One of the things that I mentioned earlier is it's used as a vehicle to deliver, and it's not the actual virus, it's a section of the virus that is one of the main genetic codes that goes into the body. And when our immune system sees this as a foreign body or as a body that it's not used to, it thinks that, okay, time for me to produce antibodies to this foreign set of genetic codes. So it's a section of the actual virus. And that's why, as we mentioned earlier, it doesn't actually give you COVID-19. It doesn't give you the disease because it's a tiny little section, enough to make your immune system say, hey, I can see something foreign. I want to produce or mount an immune response that's measured, and it's exactly enough to fight this particular genetic code. After a few days of the mRNA vaccine going into our body and does its job, the actual vehicle, the shell, gets excreted and leaves our body. So it doesn't stay in, definitely doesn't go into our DNA. And the ready-made defenses we speak about here is so that our body is ready in case we actually encounter the actual virus in the future. And I won't go into the exact immunological responses, but the way that the defenses are mounted in our bodies is a sure way of, when we see the virus in the future, we have a quick short-term effect or protection, and also slightly longer term protection as well. So it's important that we look at it from those two angles. I hope that helps, and I'm ready for the next slide. Yeah, so the AstraZeneca vaccine is formulated a slightly different way. So the viral vector vaccine, again, it's not something that is strange to us. It's something that has been used in the past, and it's a DNA kind of molecule, does not go into our DNA, but it is something that is usually present actually in our throat, in our nasal cavities. It's a type of carrier that it's always been with us before. So it's an unrelated, harmless virus, and that again delivers the genetic code into our bodies. And again, it's a way of getting our body to respond when it sees the spike protein. Our body responds with a measured immune system, and it gives our body the ready-made protection, slightly short-term and also slightly long-term, but being mindful that the full protection from the first dose does not actually happen until 21 days afterwards. So we still need to be careful, and I think Sharon kindly touched on that earlier on. The latest guidance is that anyone who is under the age of 40 will be offered an alternative to the AstraZeneca vaccine, and that's simply because there has been evidence that with some of the doses that have been delivered with the Oxford AstraZeneca vaccine, there was something called the vaccine-induced immune thrombosis, and that's been shown to be about 5 cases in a million. So again, to put that into context, it's 5 cases, yes, we acknowledge that, but 5 in a million. So if you put it into context with other maybe incidences of developing thrombosis, there are other products that's on the market, for instance, that may have a higher incidence. So anyone under the age of 30, some of those cases have been shown to be slightly higher, about 11 in a million, and anyone over the age of 30, I think at the moment it's been found to be 2 to 8 per million. So based on this information, and this is actually quite a reassuring point, that based on this information, the JCVI have reacted quickly. And this is reassuring in us knowing that when the facts change, the science will change and will adjust so that we are all kept protected and safe. So the fact that these incidences have happened, I am proud to say that the decision has been made. Proud, I wasn't part of the decision, but I'm glad to see that decision was made in response, and these new facts have not been ignored. So the latest facts were issued on the 8th of April, and anyone, regardless of their age, who's already received the first dose of the AstraZeneca vaccine will get the second dose of AstraZeneca, but going forward, that will change. These are just the recent updates. I'm ready for the next slide now. I'm not sure about the easing of the restrictions, whether you guys would like me to go through that.
Yeah, I thought that thank you so much for your pharmacist input into those slides. That's really, really helpful. Thank you. So yeah, I thought it was just a good opportunity while we're talking about vaccines, actually, to just bring in about the easing of restrictions. I had already touched on this in terms of when you've had your first or your second dose and you haven't had that 3-week period of time for your body to mount its immune response, that you need to be careful. But actually you still need to be careful even after you've had the vaccine, because we want to make sure that we don't have lots of community cases. So it's really important. As we know from the May the 17th, step 3 of the government roadmap became effective. And that's where we are right now. And there will be another announcement later on this evening around whether step 4 will take place. But we can't comment on that until that's obviously been announced by the Prime Minister later on. So at the moment we're in step 3, and it's really important to remember that the virus has not gone away. Although when we see people out and about and having fun and enjoying themselves again and mixing, you could be forgiven for thinking that actually things are going back to normal, but they're not. The virus will be with us forever. It will be something we have to live with, albeit it will be at a lower rate, hopefully, as we move forward. But we will get spikes every now and again, and we'll probably behave a little bit like flu does each year as well. Delta variant, the one that was identified first in India, is now the dominant strain in the UK. And I did talk earlier about it being responsible for about 96% of the cases now. What we do know about this variant is it's much more transmissible, so it spreads much quicker, much easier, and it is affecting younger people and those who are not vaccinated. And we are certainly seeing that now in the outbreaks that are coming through in the reports. We've said that unfortunately people will still get sick, and unfortunately some will get seriously ill and potentially die if they've not been vaccinated. And the vaccines are showing to reduce this risk. So it's really important, as Hala has said, that we all get vaccinated and take responsibility for our own health, but also for reducing the risks of transmission to our families and friends and our loved ones. I think when we're talking about the restrictions, my kind of take-home message is just because we're being told we can doesn't mean to say we should. So everyone has their own health risks, everyone has their own appetite for risk, and everyone's circumstances are different. And just because your friends are saying, oh, let's go and do X, Y, and Z, if you don't think that's safe, and you think it's not in accordance with the guidance, then you shouldn't do it. So it's kind of just making sure that you are happy to do it in accordance with guidance, and that's dependent on your own personal circumstances. And this is really, really important message now. We are moving away from the government kind of giving us all of that real step-by-step guidance of how we should do things safely, and there will be that transferal of responsibility to us as individuals. So this is where we really have to take that responsibility. And you know, the government have done their utmost to do everything possible to reduce the transmission as much as they can. And this last big push to get everyone vaccinated is really the government giving everyone the opportunity to keep themselves well and keep themselves safe. So when we look at activities that we might all start to want to do within the guidelines, we are talking about doing this within the guidance. We do need to remember that the COVID virus does spread as an airborne virus, so it spreads in the environment. So adequate ventilation is really important to reduce that transmission, and this is going to really form part of the new normal. We're already seeing a lot of talk around ventilation. It's great while we've got this fantastic weather, because it's always safer to mix outdoors where you can. If you do have to mix indoors with people, just make sure you've got your windows open and doors if possible to get that really good through flow of air. Fans are definitely not advised instead of having your windows open, because all they do is just recirculate the virus. They pick it up and just spread it really, really well, and you'll all end up breathing it in. So fans are not a great idea. If you're going into an indoor space and you think, actually, do you know, this is not that well ventilated in here, it feels a bit stuffy, you know, there's no windows, you're down in a cellar type arrangement, or there's no way of them getting any air through, and you just think this doesn't feel right, don't do it. You don't have to go in there. There's plenty of other places you can choose. And this is certainly something that I do now. I just do my little mini risk assessment. I work out how it's all looking and how it feels to me. And I just think, actually, I think I'll go somewhere else, just politely move on. And there is still, we have to remember, still a significant cohort of the population who've not had any vaccinations. And this needs to be updated, actually. So that's now the 25 years and under are the population that have not been currently vaccinated. Ready for the next slide? Thanks, Sophie. And it's also really important to take this opportunity as an infection control nurse. We've all kind of been really grateful, I think, that although we've had a pandemic, it's actually highlighted the importance of really good basic hygiene practices. And I really do hope that we maintain those, because it's kind of a bit of buy one get one free almost. So we've had the pandemic, and this virus is absolutely awful. But what we need to remember is there are also other viruses that spread throughout the year that can equally cause as many people to go into hospital, equally can cause as much harm, particularly things like seasonal flu and norovirus. They cause huge pressure on the NHS every single winter. We have A&E departments that are just overflowing with people that are unwell with these diseases, particularly the vulnerable people in our population. So that's people who live in residential settings. So whether that be young adults who live in residential settings or the elderly. So what we've seen last winter was that actually the norovirus, which is our seasonal diarrhea and vomiting, and our flu rates pretty much disappeared. We hardly saw any of this at all. And that's because we were all keeping apart from each other. We were all being much more careful. We were definitely washing our hands a lot more and using hand sanitizer and actually observing really good respiratory hygiene. And I think that's been the thing now. I think if someone has a cough or a sneeze in a shop now, you actually see people turn around and look at them and sort of think, oh, what are you doing? You know, they've probably got hay fever, but they're kind of, it's become really quite noticeable now because we just haven't been used to people coughing and sneezing all over the place. So it's good. And I think we really do need to maintain those good practices. And the reason being is that our immune systems have not been exposed to those common infectious diseases last winter as they would normally have been. So we would, if we've got young children or grandchildren, you would have been exposed to norovirus for sure, because it spreads like wildfire in nurseries and primary schools. Your children would have come home, you would have been exposed to it, you might not have got sick, but your immune system would have gone, hello, this is norovirus. And norovirus mutates every year, as does flu. So every single year we're being exposed to something slightly different, because viruses are really, really clever. They need human beings as a means to survive and spread, but they continually adapt. And they do that because that is their survival mode, and that is their way of evading our immune system. So every single year, the flu virus gets a tiny little tweak on one of the spike proteins on the outside. Norovirus does exactly the same. So if you've had norovirus last year, you won't be immune to it this year probably. So I can see that we're heading a bit to a perfect storm this winter if we don't all kind of keep up with our really good hygiene practices. As we start to go back into work a little bit more and we start to mix a little bit more, we're going to be all exposed to this. So just keep up the good hand hygiene and respiratory hygiene practices going forward. And if you have got primary age children in the family or your friendship group, be mindful that one, they don't mix with others if they have cough and cold or flu symptoms, or within 48 hours of having any diarrhea or sickness, because within that 48 hours, even after the symptoms have stopped, they are still infectious and they can transmit the virus. And the last thing to say about norovirus is that you only need a very, very small infectious dose to make you sick. It's something like 10 virus particles, which is absolutely nothing in the great scheme of things. So just a sort of a nice take-home message for life as we go forwards. Thank you, Sophie.
So I think, yeah, we've reached the end. So I don't know if there's anything else, Sharon or Hala, that you'd like to add, or if there are any questions, pop them in the chat, or yeah, just shout them out.
Sorry, I lost my screen there. Apologies for typing. Yeah, anyone with any questions in the chat or anything that anybody wants to raise? I think it's been a really, really helpful presentation. I've really enjoyed it, and I've really enjoyed working with Hala on this as well. It's been good to be able to collaborate, hasn't it, and bring our expertise together. I think it's been really helpful.
We can be the next double act if this is.
Yeah, absolutely.
It's all for a good cause as well. So I just wanted to build a couple more things on an excellent presentation. Thank you so much, Sharon. I want to remind people to test regularly, PCR tests. I think that's something that's really important, and the tests are, available from all good pharmacies. So you can actually get the PCR test from pharmacies now. ones that are taking part, but they're available once you go into the .gov website and you put your postcode in. But generally, pharmacies are supplying the PCR test. So regular testing, really important. If you have any concerns or any questions that you have about the vaccine, about your medication, about interactions as well. I mean, I'm biased, but I would say go and see your community pharmacist. And that's where you would get really easy, accessible advice. You can also check NHS 111. You can do an online questionnaire with NHS 111. That's the easiest way rather than waiting on the phone to speak to them. But if you feel that there is any concern, you can speak to your pharmacist, you can speak to your GP, and you can speak to NHS 111. These are the three places that I would say would offer the most support right now and most accessible support. And just my final statement for today, before we go on to questions, is on the day when you do go in to receive your vaccine, the best vaccine for you is the one you get offered on the day. So please take it. And thank you all for listening. And I'm Hannah.
Thank you. You've just prompted me just to remember a couple of other points, actually. Thank you, Hala. So it's also important to say that if you've tested PCR positive, which is obviously the gold standard of testing, if you've tested PCR positive for COVID-19, you cannot have a vaccine until 28 days after that test result, but you can still be vaccinated. You just need to wait that 28 days. And regardless of whether you've been vaccinated or not, as Hala said, testing is really, really important. If you are offered the opportunity outside of the pharmacy route to have a PCR test as well, because we are doing some targeted testing in Hammersmith and Fulham currently in certain population areas where the data is suggesting we've got more transmission than we would like. If you are offered that through a mobile testing unit, which is going to be advertised in your areas, please do take that opportunity to get tested. Even if you've been doing lateral flows all week or you've done a PCR last week, the test is as good as it is on the day, and it's as good as the amount of viral load that you have in your nose and throat, as Hannah has explained. So you may have COVID-19 but test negative, and then a couple of days later develop symptoms, and that's just because the viral load wasn't enough to pick up in the test. So it's kind of just observing symptoms and observing your testing and just doing as much as we all can to try and break those chains of transmission. Thank you.
Great, thank you both. I just had a question actually, and it was, now that kind of vaccinations are obviously being offered to younger people, I've just heard, a lot of young people saying, COVID-19 is less likely to impact them badly. So what's the rush to be vaccinated? Why can't I just wait a bit longer? And I just wondered whether either of you or both of you could kind of offer some kind of response to that, because yeah, as now that young people can be vaccinated, they really need to. So yeah, any thoughts on that would be really, really helpful.
Shall I go first, just based on kind of the experience at the moment that we're seeing in the borough? So a big part of my job actually is around trying to, one, prevent outbreaks happening in the first place, but when they do happen, trying to stop them in their tracks so that we don't end up with bigger outbreaks than is necessary, because outbreaks shouldn't be inevitable. Cases will be. We know that people will catch the virus, but actually we shouldn't accept an outbreak as a normal situation. And what we're seeing now in our universities is that we are seeing outbreaks again. And we are seeing in that younger population, people who are going into hospital. And that's kind of on the ground, real-time data from last week. As we go through the line lists of people when we're discussing outbreak management, we are seeing people go into hospital. We don't know the effect of long COVID on the younger population. And for me, I understand the younger population probably have a different perspective on this, because historically they haven't seen their peers going into hospital so much. They are now. But actually, why take the risk? You don't know. You could end up with long COVID. You might have mild symptoms, and then you may end up where your life is severely impacted with long COVID, and it's indiscriminate. We don't know yet. There's not enough research yet on long COVID to know who is going to be affected and who isn't. So it's a bit of a kind of a gamble. If you're not going to get vaccinated, you're almost playing with the rest of your life in some respects, because, you know, 10 years down the line, you could have these horrendous long COVID symptoms that actually affect your ability to work, to perform your sort of day-to-day activities. We've seen some really debilitating and devastating effects of long COVID, and you know, we're not in a position yet to understand it. They've set up specialist clinics in NHS trusts now where they've got these long COVID clinics because they're just having to learn on the job. They just don't understand enough about it. And then there is that kind of being that more, you know, having a bit of a responsibility for your peers, your family, your friends. So it might not affect you too much, but if you've got vulnerable people in your family, elderly relatives, you know, your grandparents can still catch COVID. Now we know that they might not get such severe disease, but they would still catch it again, even if they've been vaccinated. Would you want to have that on your conscience as well, that you're potentially spreading infection? And then the other really important thing is as well, is that if we don't get on top of this virus and if we don't get on top of these variant strains, we're going to be in this position for quite a long time. So normal life that people are craving to get back, which is never going to be really normal, is not going to happen. We're just going to keep ending up with delay, which no one wants. And that then has the knock-on effect of people's mental health and all of those kinds of things. So I think that would be my kind of take on it. Hala.
Yeah, I totally agree. I was nodding all along. You did take one of the points I was going to mention, so I won't repeat it. But what the other one was actually going back to something you said earlier, which is the Delta variant has been proven to be more transmissible in younger people. So that's one of the other reasons why the facts have changed, you know, where maybe younger people were not seen or tested or proven to actually transmit the initial variants. Now with the newer variants, the latest variants, there's definitely evidence that's more transmissible within the younger population. And some of them, as Sharon said, may be asymptomatic, but those may be looking at the wider collective and looking at you know, having responsibilities about a social responsibility as well. Just one thing I wanted to add is the UK is we're very fortunate that the UK is actually very good at sequencing the virus. So checking all the mutations and looking at the sequences of any new variant. I would say the UK is at the top of that you know, initiative. So we are very lucky that we get these new variants identified very early on and looked at and acted upon. So the new variant, which is the Delta variant, was identified and sequenced very early on. And the evidence is in younger people, it is more transmissible. So one more reason why we need to think about the long-term effect. And I totally agree with Sharon, long COVID is something that we have not got much evidence of, but from what we know so far, I think it's something that we also need to protect younger people. They're the next, you know, they're the future, they're our next generation, and we need to make sure that they're healthy and well and setting good examples for more people, more generations to come. So thank you.
Great, thank you both. That was really helpful. If anyone does have any questions, please feel free to pop them in the chat, or you can email myself, and I'll make sure your questions are passed on. Just to add as well that this recording will be on YouTube, so you can access this at a later date. And we are offering a series of virtual workshops throughout the week to mark Refugee Week. So please do check them out on our Hammersmith and Fulham website. And I just wanted to close by saying a big thank you to Sharon and to Hala for being with us this morning and giving kind of their expert knowledge on vaccination. I hope that it's been really helpful for you. I know that I've certainly found it very helpful. So yeah, a big thank you to you both. I don't know if you want to add anything else before we close.
I just want to say thank you for inviting me, Sophie. I think it's a really worthwhile opportunity, and any opportunity that I get to kind of impart my knowledge and advice is always really welcome, just getting those messages out there. So thank you very much. And thank you to Hala for supporting with all of the pharmacist specialist knowledge as well. It's been really, really helpful for me as well.
Thank you. I was going to thank you as well. So it's all lovely and it's a nice kind space as well. So I just I wanted to also say that I think running these kinds of events are very important so that we can also show people out in Hammersmith and Fulham and generally that we are available to help and support. So when you appear on screen, however many people are listening to us, or whether it gets looked up on YouTube later on, it may be a smaller effect today, but then it will build up. But it's neat. I think we need to be visible and need to be seen to be supporting people. And so these kinds of events are great, rather than us sitting in pharmacies and offices and saying people could come to us. We're going to people and meeting them where they are. So I hope this is going to be helpful to some people, Hammersmith and Fulham and the wider UK as well. So thank you for inviting me, and great to meet you, Sharon. Meet you.
And you too. Thanks, everyone.
Yeah, thank you, everyone. Yeah, that's been really helpful. And yeah, do check it out on YouTube if you want to find out a bit more or to rewatch any of it. But yeah, enjoy the sunshine, everyone. Thank you very much.
Thank you. Bye for now. Bye.
Bye.